Around the world, millions of people live behind bars, deprived of their liberty. Whatever the reason for their arrest and detention, they are entitled to be treated humanely with respect for their physical and mental well-being. Detainees find themselves in vulnerable situations, dependent on detaining authorities to meet their basic needs. Their rights to be free from torture and ill treatment and to fair judicial guarantees and procedural safeguards are not always respected. Limited contact with loved ones and uncertainty about their future create tensions as they struggle to adapt to new rules and routines.
بظروف الحرب والنزاع الذي كان حاصل في البلد وتم احتجازي فترة تتراوح ما بين 5 إلى 4 سنوات و7 أشهر. أصعب شيء أثناء الاعتقال هو الحرمان، وثاني حاجة لما يكون جنبك زميلك، يعني كان أخ خلاص ما عادوش زميل، يعني كان نعتبر أسرة واحدة. فكان أصعب شيء نعانيه إنه لما يكون زميلك جنبك أو أخوك تعبان يموت جنبك مش قادر تعمل له حاجة. هذا أصعب شيء.
States and detention authorities are responsible for ensuring humane treatment of those in their custody, yet places of detention are often neglected. Since its founding in 1863, the International Committee of the Red Cross, ICRC, has worked to protect and assist victims of armed conflict and violence, while advocating for governments and armed groups to respect and strengthen international humanitarian law. From its early days, the ICRC has been visiting detainees around the world to improve their treatment and living conditions. The 1949 Geneva Conventions granted the ICRC the right to visit prisoners of war and civilian internees in international armed conflicts. In other contexts, the ICRC seeks to provide similar humanitarian services and negotiates access with relevant authorities. To reflect the evolving nature of armed conflict, today we also visit political prisoners, security detainees, and common law offenders, regardless of whether they are held in prisons, police stations, camps, or military facilities. Each year, the ICRC has access to over 700 places of detention, housing approximately 800,000 detainees across 70 countries. By visiting detention facilities, our multidisciplinary teams see what conditions are really like. To fulfill our mandate, the ICRC must have access to detainees and the facilities they are held in. Each visit starts with a discussion with the authorities in charge. Together, we then check on all facilities and infrastructure such as living quarters, cells, kitchens, sanitary and health facilities, exercise yards, disciplinary cells, and visiting areas to observe firsthand and gain a better understanding. These steps allow us to meet with staff and engage in discussions with them. The cornerstone of the visit is a private interview with the detainee. Away from authorities and other detainees, the prisoner can speak freely about their concerns.
بطعم حقوسي مخنياتو توزلت هنصي ያው ተስፋ ዘሎ ማለት ችግሩና ዝፈትحلنا መስሉ ይርዱ እግዴታ ምክንያቱ ለችግርና ለምጥያቅ እንደምትመጽ ዘለኹም ታይ ችግር አለ ይልኩም እንደኹም ለመርዳእ
ICRC teams identify and register any detainees requiring individual follow-up so that they can check up on them during subsequent visits, even if they get transferred elsewhere. By listening and talking to detainees, delegates can identify humanitarian problems.
Quand nous faisons des visites en détention, nous identifions les personnes individuellement vulnérables qui ont besoin de soutien individualisé, spécialisé, Et à ce moment-là, le CICR intervient tout d'abord en dialoguant avec les États, en les rappelant l'ordre de soutien de ces individus et voire même faire une intervention individuelle de la part du CICR.
The ICRC should have the right to revisit the facility as often as necessary and to monitor detainees to ensure appropriate follow-up. This permission is essential for achieving lasting and positive improvements in the treatment and conditions of detainees. At the end of the visit, ICRC teams meet again with the authorities in charge to discuss concrete measures for improving the treatment of detainees, as well as detention conditions and management practices.
ስለዚህ ጽቡቕ ርክብ እዩ ዘሎ ክፍተትና ንሱ እዩ ዝምልአልና ኣብ ቁርፂ እዋን ኣለኹ ዝበለና እውን ንሱ እዩ ስለዚ ቀይሕ መስቀል ካብ ጎድነና ዘይፍለ ክፍተትና ዝምልእ ኣጠቓላሊ ድማ ካብ ዕላምኡ ወፃኢ ዘይኸይድ ዓለም ለኸ ግባር ሰናይ ስለዝኾነ ንሕና እውን ብፀጋ ኢና ንቕበሎ
Agreement on these visiting procedures lays a solid foundation for cooperation. It enables the ICRC to have a full understanding of the humanitarian concerns in a place of detention and to foster transparent and constructive dialogue with the authorities.
The ICRC seeks to have a relationship of trust with the detaining authorities and with the detainees. In order to have that open and frank dialogue, you need to do that in confidentiality. We speak to all the parties, we raise issues of humanitarian concerns. It builds that relation of trust that allows us to have access to detention places and access to the detainees that are in need.
Dire conditions of detention can sometimes turn a prison sentence into a death sentence. When conditions are inadequate, they can have direct and irreversible consequences on both the physical and mental health of detainees. Detainees sometimes wait months or even years for their cases to come to trial, placing additional pressure on facilities that are already stretched thin. Overcrowding severely impacts living conditions. Insufficient space and services creates numerous challenges for the safe management of detention facilities, including increased insecurity. It can also affect the physical and mental well-being of detainees, staff, and families outside. Communicable diseases can spread very quickly, requiring careful prevention and treatment programs to avoid outbreaks and spillover into the community.
When a detainee is sick inside the prison, eventually he will go back to his family. His family will be sick. If a visitor comes to visit a detainee who is sick, eventually they will be sick. A guard who is accompanying detainees all day eventually will be sick. So when we talk about healthcare and detention, this is not a problem that is bound by walls. This is a much more wider problem that affects the whole society and community.
Ceux qui ne mangent que ça, malheureusement, ça ne peut pas couvrir les besoins. D'autant plus qu'ils devraient recevoir 750 grammes par jour. Dans la prison de Tullère, ils en reçoivent 400. Dans d'autres prisons, ça descend à 200, 250 grammes. Donc c'est complètement insuffisant, tant sur le plan quantitatif, c'est-à-dire rapport énergétique, qu'évidemment sur le plan qualitatif. On ne peut pas se nourrir exclusivement de manioc au quotidien, hein. Ça manque de tout malheureusement. Et à long terme, s'il n'y a pas d'apport autre, c'est forcément létal, hein, c'est un décès.
En tant que chef d'établissement, notre premier rôle, c'est d'éviter qu'il y ait la mort des personnes détenues et que les personnes détenues mangent à leur faim au jour le jour, malgré le peu de moyens qu'on a.
The authorities are responsible for ensuring that medical care in detention facilities is at least equivalent to that available in their wider community. Prison staff provide a vital public service and also deserve to work in a safe and healthy environment. The ICRC adapts its actions to the specific needs of each country, whether to support the strengthening of healthcare provision in places of detention and protect public health, enhance the entire food supply system to combat malnutrition, or improve infrastructure. Where infrastructure is being replaced, the ICRC can also advise governments on planning and designing new prisons, aligning with humanitarian principles, local needs, resources, culture, and environmental factors. Across all regions of the world, despite their absolute prohibition, intimidation and violence are used to extract confessions or silence dissent. Such abuse inflicts lasting physical and psychological scars that can last a lifetime.
في هذه الفترة شعرت بأنني بدأت أنقطع عن العالم، وهذا الشعور بدأ يرعبني. لم أعد أستطيع التحمل. الحياة أصبحت بلا معنى، وأن الموت صار أفضل من الحياة. نتيجة في شيء آخر بدي أكله اللي هو الحرية.
Ill treatment and torture devastate families, friends, and even the perpetrators, eroding the social fabric of communities and societies. This ultimately hampers peace and reconciliation long after conflicts have ended.
Sometimes based on resources, the level of conflict, the complexity of war, you may not be able to have all of the necessities. And what I mean by that is a great air-conditioned tent or a great air-conditioned barracks or the best food in the world. I understand that. But what you can do is do no harm, meaning there's no reason to apply torture, all right? First of all, it doesn't work, right? Studies have proven that if you're going to interrogate somebody, you build a relationship and a rapport with that individual, and you're more than likely going to obtain relevant information as opposed to applying torture.
Abuse is far less likely when judicial guarantees are firmly in place. Having effective safeguards, especially during the early stages of detention, can prevent ill treatment and disappearances. These safeguards include being held in an official place of detention, promptly notifying a family member or a friend that their loved one has been detained, having access to a lawyer, ensuring a medical examination occurs by an independent physician as soon as possible after a person's been detained, as well as being brought before a judge or a tribunal in a timely manner. Now, when these fundamental protections are not respected, the ICRC reminds the authorities of their obligation.
Places of detention are complex systems that sometimes require simple but targeted and practical solutions, as well as coordinated efforts across multiple actors and state institutions. The ICRC, through its multidisciplinary teams and experts from various fields, health, engineering, nutrition, law, protection, and prison management, engages with authorities at all levels to provide advice, support, and strengthen the skills and knowledge needed for sustainable change.
Donc ça permet en fait de réunir des praticiens dans la même salle, de visiter des lieux de détention, de pouvoir en discuter ouvertement, parce que de nouveau il n'y a pas d'endroit idéal et il n'y a pas que de mauvaises choses, et de pouvoir essayer d'identifier qu'est-ce qui marche bien, de pouvoir après les reprendre à la maison et pouvoir peut-être les mettre en œuvre.
For many detainees, one of the most challenging aspects of detention is to be cut off from loved ones. Red Cross messages help prisoners stay in contact with their families. These open letters to relatives contain personal news only.
So, sir, if you want, you have the possibility to reply back to your brother. Would you be interested to do so?
In the event of armed conflict, our neutral and independent status allows us to collaborate with all parties involved to facilitate the exchange of family news across conflict lines and borders.
Писать везде письма. Конечно, миллионы километров было исхожено. Очень много людей помогали в поисках сына. Через какое-то время звонок, говорит, это Красный Крест. Все равно мы его нашли, мы узнали, что он в плену, и самое главное, он жив. Я плакала, кричала, я прыгала. Я была самым счастливым человеком.
Modern technology has simplified communication for families. The ICRC facilitates verbal greetings, phone calls, pre-recorded videos and video calls in over 70 countries. But video calls are no substitute for family visits. If the situation allows, the ICRC can act as a neutral intermediary to facilitate the release or exchange of prisoners of war, detainees and hostages, enabling them to return to their families. Every day around the world, men, women and children are deprived of their liberty. The ICRC works to ensure humane treatment, prevent rights violations, and reconnect families. We strive for a future where every individual is treated with dignity and humanity.